that this year alone, 17,000 people will be diagnosed with a rare cancer known as sarcoma. According to the Sarcoma Alliance, that is 2 people every hour, 47 people every day, 327 every week, and 1,427 every month. And I'm not a medical professional, but I have extensively researched this cancer, and I've dealt with it firsthand with my mother. She has extraskeletal myxoid chondrosarcoma, and it has been since 2008, when an oncologist in West Virginia, who had only seen the case one other time, said that her care was hopeless, and she went to a sarcoma center in Johns Hopkins, and is still alive. She has stage 4 sarcoma. Stage 4 means it is metastasized from its original location, and cancer affects most families at some time during a lifetime. If we haven't dealt with cancer often, we don't know that there are many types of cancers, including rare types, and sarcoma is compared to the frequency of other cancers and may not have heard about it because it's only 1% of all the cancers, and this is only 1% of the cancers, and this is the sarcoma, the chondrosarcoma. And today I'll introduce one of the rarest forms of cancer, sarcoma, and discuss where these form, what causes this type of cancer, and current treatments. And my first main point, where sarcomas form. And bone sarcomas can form in any bone in the body, but most often occur in the arms and legs. These are often easier to treat than soft tissue sarcoma because most often surgery or amputation is possible to get rid of the cancer. And surgery is the best option for sarcoma, as it doesn't respond well to medication or chemotherapy or immunotherapy. And soft tissue, according to a cancer journey, soft tissue sarcomas are rare tumors that account for 1% of all adult, with over 100 different subtypes, according predominantly in the trunk extremity. And these tumors are often slow growing, but can get very aggressive. The tumors are often described as indolent or lazy tumors. And surgery is often difficult due to the size and number of the tumors, as well as the position of the tumor. Many of these tumors can attach to vital organs and commonly metastasize to the lungs. And this is the type of cancer my mom has. She has 10 soft tissue sarcomas, according to the extraskeletal myxoid chondrosarcoma. A retrospective review from 2 referral centers said long-term outcomes with surgery and chemotherapy, which was written in part of my mom's oncologist, Dr. Robert G. Mackey. And external myxoid chondrosarcoma is genetically distinct sarcoma. And it usually has a recurrence and metastasize despite an indolent course to the author's knowledge. There are limited data examining chemotherapy outcomes as a guide to the therapeutic decisions for unresectable disease. With soft tissue sarcomas being so rare, there is little research to guide doctors. More effort is put into research for common cancers since they affect a greater number of the population, and this is only 1% of all the cancers. Soft tissue sarcomas recur often. This means even if surgery is effective, they will come back. When they do, it's not always in the original part of the body, and this is called metastasis. According to why do patients with low-grade soft tissue sarcoma die, also my mom's oncologist, patterns of reoccurrence and death are predicted by primary tumor size. And my second main point, just as much isn't known about sarcoma, very little is known about the causes of sarcoma. Sarcoma is known as a bad luck cancer, meaning it's known to be very unlucky in the individual. According to Mayo Clinic, it's not clear what causes most sarcomas and general cancer forms when mutations happen in the DNA within cells. The DNA inside a cell is packaged into large numbers of individual genes, which contains a set of instructions telling the cell what functions to perform. And as well, to grow and divide. Mutations might tell cells to grow and divide uncontrollably and to continue living when normal cells would die. If this happens, the accumulating abdominal cell can form a tumor. Cells can break away and spread, metastasize to other parts of the body. And the Mayo Clinic does not list, or if they do list some of the factors, inherited syndromes, radiation therapy for cancer, chronic swelling, exposures to chemicals, and exposure to viruses. And my third point, surgery is the best treatment option. My mom had some major surgeries at Johns Hopkins and the University of Pennsylvania. Both times chemotherapy isn't overly effective for sarcoma, but is a good option when surgery isn't possible. It can slow the growth of the tumors. Immunotherapy is an infusion like many other chemotherapies, but it works differently. It activates the body's immune system to fight the cancer. And according to Sarcoma, the standard bearer in cancer discovery, it is because sarcoma researches, and we have immunotherapy. It was discovered during the sarcoma research, and immunotherapy is effective in other cancers as well. In conclusion, today we have discussed of the rarest forms of cancer, sarcoma, as well as where these form and what causes them, and type of cancer and the treatments, and how rare they are. And they're so rare that doctors barely know how to fight them. And there are two types of sarcoma: bone and soft tissue. Soft tissue being the hardest to treat. Most sarcomas form in the limbs, but soft tissue forms in the trunk of the epiderm. There are no known causes of sarcoma at this time, but there are some risk factors. The main treatment are surgery, chemotherapy, and immunotherapy. More research needs done to save lives. In 1 year, and there will be 17,000 people in the United States alone who are diagnosed with sarcoma this year. We need to advocate for these patients, and we need to learn to treat them better. And the quote is, "Yesterday is gone, tomorrow has not come yet, but we only have today, so let us begin."